Hi everyone, I'm Cheryl Butler, and you're listening to the Mighty Mommy's Quick and Dirty Tips podcast, which will help make your life as a parent a little bit easier and a lot more fun. Welcome! Today's episode is number 507, 5 answers to your early pregnancy questions, because this is such an exciting time in your newly pregnant life, and moms-to-be have a lot on their mind. I love surprises. That wasn't always the case, though, because back in my 20s and 30s, I was a real planner and felt the need to be in total control of where my future was going. Coincidentally, or not, it was in my late 20s that I struggled with infertility for over 5 years. Let's just say that this pivotal time in my life afforded me the opportunity to find out, in the not-so-easiest of ways, that planning and scripting my life would not necessarily turn out the way I had intended. My original plan, after marriage, was to spend a couple of years building my career, traveling, and creating our dream home. Then we'd begin a family, probably 3 kids, and the rest would be history. Well, that sure didn't happen. 5 years after trying to start a family, we finally became the blessed parents of a beautiful baby girl through the amazing gift of adoption. During that time, without kids, we enhanced our careers, traveled quite frequently, and bought our dream home. I also spent that time obsessed with becoming pregnant and didn't enjoy my existing circumstances as much as I should have because I longed so much for a baby. That was the start of when I began to embrace life's surprises. Shortly after our adoption, I gave birth to 7 more children. We moved from our dream house to my former childhood home so we could be closer to our families. I stepped away from my career and, after 25 years of a mostly good marriage, became divorced. Because I was now getting good at going with life's flow and not staying attached to any outcome that I thought I had to have, I was able to truly live in the moment and appreciate what was happening in the now, not the past or future. So, getting back to how I now love surprises, I was given quite an amazing surprise this past year for my birthday. My daughter and her husband announced that they were expecting their first baby, my first grandchild, on Christmas Eve of this year. I was not only pleasantly surprised, but so excited I could think of nothing else for weeks after the announcement. My daughter was super thrilled as well, but she was full of questions that she needed answers to and a tiny bit embarrassed to ask her doctor because she didn't want to seem like she was a pesky patient. Thankfully, she felt comfortable asking me, veteran mom of 7 trips to the delivery room, and I was only too happy to answer them for her. Pregnancy is one of the most miraculous times in a person's life. Every pregnancy is different, something I'm absolutely qualified to state, as are a woman's labor and delivery experiences. Here are 5 questions my daughter, now 8 months pregnant, and I have discussed and are happy to share with other expectant moms who have a lot of unanswered thoughts on their mind. I've combined Mighty Mommy experience and professional expertise in the responses. We'll cover the following 5 questions in this episode, which mostly affect the first trimester. What early pregnancy symptoms are a concern? Prenatal vitamins. What if I forget to take them? Pregnancy emotions. Pre- and postpartum blues. Are they for real? Pregnancy digestion and gas. What the heck? And what's up with these constant leg cramps at night? Next week's episode will focus on the urgent questions moms-to-be have regarding the later stages of pregnancy, like the final trimester and labor and delivery. Okay, let's jump in. Number 1. What early pregnancy symptoms are a concern? The early stages of pregnancy are very surreal. You've seen the positive result on your home pregnancy test, possibly had it validated at your doctor or midwife's laboratory, but it's still so very new. You're not quite sure what to expect in these very early weeks. Though your belly has not started blossoming, there are many other symptoms starting to take place, most of which are not a concern. Please note, however, that you should always check with your healthcare provider for any medical concerns. Here are common symptoms that might cause concern, but don't have to. Spotting, which is minor bleeding and cramping of the uterus. This is so very common in early pregnancy, and in fact, happened to me with all of my pregnancies. WebMD explains it perfectly. After conception, the fertilized egg attaches itself to the wall of the uterus. This can cause one of the earliest signs of pregnancy, spotting and sometimes cramping. That's called implantation bleeding, and it occurs anywhere from 6 to 12 days after the egg is fertilized. Tender breasts. Plain and simple, your boobs are most likely going to be very sore and sensitive as they prepare for their biggest job ever, feeding your newborn. Change in color of your vagina. This is not one of those topics most women discuss, the color of their private parts. Why would you even need to know this? Not to worry, a blue vagina during pregnancy is a healthy vagina. Known as Chadwick's sign, it's caused by increased blood flow down below. Unless you're literally looking for it, you may not even know that it's happened since it doesn't cause any discomfort. Regardless, the blue or purple hue should disappear shortly after you give birth. Sharp pain in the abdomen. I remember how scary and uncomfortable this pain was, and my daughter expressed how much she was concerned about it. Many times, this pain is referred to as round ligament pain. This ligament supports the uterus and stretches during pregnancy. According to AmericanPregnancy.org, any movement including going from a sitting to a standing position quickly, and even laughing or coughing that stretches these ligaments quickly can cause a woman to experience pain. Thankfully, this pain should only last for a few seconds. Number 2, prenatal vitamins. What if I forget to take them? One of the first regimens in your newly pregnant life will be to start taking prenatal vitamins. These important supplements are not absolutely essential for your health, but they can be a big asset for it. They're formulated especially for pregnant moms with high levels of essential nutrients such as folic acid, which can help prevent birth defects and complications. I was always a firm believer in taking prenatal vitamins, even though they really caused me an upset stomach during the first trimester. We're all human, so don't be surprised if you forget to take your prenatal vitamins from time to time. If that happens, don't sweat it. In All About Prenatal Vitamins, Your Questions Answered, OBGYN Ashlesha Dayal, MD, writes, if you forget your vitamins once in a while, don't panic. And don't double up because they make you feel sick or increase constipation. I usually recommend that my patients put any daily medicine in a place that they go every day, such as next to their toothbrushes or their hair dryers, car keys, etc. Sometimes you can even set a daily reminder or an alarm on your cell phone so that you can remember to take your vitamins. Number 3, pregnancy emotions, postpartum blues. Are they for real? This may come as a huge surprise. Remember, I love surprises. But despite my years of struggling with infertility and then being pregnant and delivering 7 babies within a little over a decade, I was never affected by pregnancy emotions. It must have been embedded in my subconscious that since I had waited so long to finally experience motherhood, no way was I going to ride the emotional roller coaster of pregnancy. But that's me. My daughter didn't have the same difficult start as I did to becoming pregnant, and she readily admits she feels challenged by the many emotions that accompany a pregnancy. Emotions are triggered by so many sources other than hormones, says Dr. Frank Ling, professor and chairman of obstetrics and gynecology at the University of Tennessee. Even the physical discomforts of pregnancy, such as morning sickness, breast tenderness, or constipation, can play a role, since you naturally feel down when you're uncomfortable. Yes, pregnancy emotions are definitely real, and most certainly normal. You may not know that depression during pregnancy is also called antepartum or prenatal depression, and it's nothing to feel ashamed about. According to the American Congress of Obstetricians and Gynecologists, between 14 to 23% of women will struggle with some symptoms of depression during pregnancy. Postpartum and antepartum depression are temporary and treatable with professional help. If you feel that you may be suffering from one of these illnesses, know that it is not your fault and you're not to blame. It's so important to seek professional help as soon as possible. Talk with your healthcare providers about some of the other natural ways to help relieve the symptoms of depression, such as exercise, rest, acupuncture, herbal remedies, and more. Number 4, pregnancy digestion and gas. What the heck? One of the most common symptoms of early pregnancy is morning sickness, which is nausea during the first trimester of pregnancy that typically impacts women during the beginning of the day. However, in my 7 pregnancies, I was quite ill throughout the entire day for 6 months. Yikes! The reason for morning sickness is the result of increased hormones in your body, which results in a very sensitive stomach, often accompanied by vomiting. Ah yes, the joys of pregnancy. Bloating is another early symptom of pregnancy and completely normal. And with bloating comes another common sign of pregnancy, passing gas. Oh, come on, we all do it. Flatulence, tooting, breaking wind, whatever you want to call it. It happens to the best of us. And when pregnant, much more often than usual. The typical person will pass gas approximately 18 times a day. The reason for this is that the average person produces up to 4 pints of gas daily. Pregnant women, however, have a lot more hot air than the norm. If this is a topic that makes you feel a bit uncomfortable, the American Pregnancy Association provides the following recommendations for managing, reducing, and hopefully preventing extra gas during pregnancy. You can avoid or reduce carbohydrate drinks, avoid fatty fried foods, drink from a glass without using a straw, focus on smaller meals throughout the day, exercise, which will help stimulate digestion, avoid tight clothing around your waist, limit or avoid artificial sweeteners, drink plenty of water, which will help prevent constipation as well, and eat slowly and chew your food thoroughly. If these suggestions don't work, remember, you're not alone. Having a baby is one of the most precious experiences in a lifetime. And if that means you have to toot your own horn, so be it. And number 5, what's up with these constant leg cramps at night? One of the most standout pregnancy symptoms for me was not aching nipples, a Smurf-like blue vagina, or the crazy moments of having to pass gas in dozens of public places, but instead the writhing pain I'd experience in my calves throughout the night. From past pregnancy experience, I was advised the following. Drink plenty of water during the day, as staying well hydrated helps muscles contract and relax properly. I also elevated my legs on a plump, fluffy pillow, and sometimes took a warm bath before bedtime, which helped to ward off muscle spasms. In Pregnancy Birth Babies article about leg cramps during pregnancy, the experts state that there are many possible reasons for cramps while you're pregnant. Carrying extra weight, obviously, changes to your metabolism, having a vitamin deficiency, and being too active or not being active enough. The truth is that nobody really knows. The important factor when experiencing these highly uncomfortable leg pains is not to panic. You can bring on relief if you stay calm and work through them. These steps work when you have a leg cramp. Stretch your calf muscles immediately by straightening your leg, heel first, and gently flexing your toes back towards your shins. Don't point your toes while stretching, because that can make the muscle contract and worsen the cramp. This stretch might hurt at first, but it will ease the spasm and gradually make the pain go away. After you stretch, massage the muscle or warm it with a hot water bottle or hot towel to relax the tissue. Walking around for a few minutes may help too. This is what always worked for me. And drink plenty of fluids throughout the day. Next week, we'll visit some very important questions that affect the last trimester of your pregnancy, including your sex life, the emotional turmoil of depending on an epidural during labor, and whether bonding with your newborn is crucial to a loving mother-baby relationship. What's on your pregnancy mind? Share your thoughts in the comments section at quickanddirtytips.com/mighty-mommy or post your ideas on the Mighty Mommy Facebook page. And if you have friends and family that would enjoy listening as well, I'd be so pleased if you'd share the link to this podcast and refer them to the website, which is www.quickanddirtytips.com/mighty-mommy. Here, you'll find hundreds of archived episodes covering a wide variety of parenting and family-related topics. Wishing you and your family a terrific week and a very joyful pregnancy. As always, thanks for listening, and until next time, happy parenting.